Our final story is with the heroes of the pandemic, and of course I'm referring to those frontline workers. The healthcare professionals at Carefor help seniors and people with disabilities live well at home. Well, you can imagine there are so many challenges put in place when COVID-19 hit, and they have managed to keep their patients safe throughout. Here are some of those stories we share with you this week.
Well, certainly on our clientele, it's significant. We do service the most vulnerable people in the community to the pandemic, to the coronavirus. And so it's been significant for us. Certainly, as much as other health sectors have shifted to support assessment centers, testing centers, and we've also had shifts in terms of the type of work that we do. As hospitals were not pumping out surgeries, therefore our home care staff were not as occupied at the time, meaning our nurses, our PSWs, but we still had to provide care to clients who are on service for long periods of time. So we maintain those visits, the volumes that we were, for about 75% of the volume that we were doing in the past. But where we shifted our energy was really around doing more virtual visits, so engaging people.
At the beginning, basically, we could only go see the really critical people, if we felt like if we don't go, they're going to go back to the hospital. We had the okay from the LIN to do phone interviews. So it was mostly over the phone. And then after a couple weeks, we were set up to do Zoom meetings, but the issue is that most of them, they don't have the technology to do it. So that was a big challenge.
Emotionally distressed. Some of our clients don't know why. They feel special because we have to put them in another room. Why do they have to say this? So they're stressful about that. And they want to talk to us, and then we can't always sit like we do before, sit and listen to them because of what's going on. And why are we wearing masks? Are we wearing gloves or our gowns and stuff? Why are we wearing that and they are not wearing it? Are we afraid of them? Things like that, they would ask us that.
A lot of our clients are single people and they're living on their own. And of course, when you have to self-isolate, they're totally on their own. And they're very lonely. And obviously after a while, emotionally, they really need a lot of support, but it's not there because people can't do it anymore. You don't get the social aspect of it. So I can see it.
Isolation has affected everyone in the world, right? And then people who live with mobility impairments and disabilities, they already have a hardship every day, even before the pandemic. But now with the pandemic, it just amplifies that even more.
In the beginning, their families weren't coming, the grandchildren weren't coming, so we were the only face that they were seeing, and it kept some regularity where they were still guaranteed to get their shower, to have a decent meal cooked at least once a week or twice a week, however often they can have their visits. And it helped them stay attached to certain things, because a lot of them, they're elderly. They don't understand the computer and the internet and these fancy cell phones. They don't know how to do the video chats, and so it's very difficult. So to see us and to keep some sort of normal was very helpful.
I did have a client who faced a crisis because of the progression of his disease. He needed some medical equipment to enable him to stay home. A lot of what we do, we're keeping people in their homes and out of the hospital, right? That's ultimately a big part of our role. And the gentleman had a significant decline in his mobility, and he couldn't get off his couch. Okay, he had to phone 911 to get off his couch. And part of my job is to make sure that he has a safe way of being able to do that. So I prescribed a rather expensive piece of equipment to allow that for our Carefor PSWs to help him from A to B with the mechanical lift. I got it fully funded, but the company that had the contract to deliver it was shut down because of COVID. So here he is. But with the Champlain LIN, they were also adapting and putting in, emergency measures. So they were able to loan one to him in the interim to allow him to stay home.
You know, there's a client and he's doing okay, but he learned he's going to have to get cancer treatments. So it was very important to keep up his visits. And he's gone through the treatments now and he's done very well so far. But it was very important because his family couldn't really visit him much, and they were able to drive him to his appointments, but they couldn't be in the hospital with him, and they couldn't really they didn't want to be in his house to risk anything, so they're just sort of driving him there and back. So I come in a few times a week and help him with a bath and help him with food and talk to him. And it made things normal for him in a way. And it's very scary going through the cancer treatment and being in the hospital when you're by yourself and they have to wear a mask and things and they don't know where they're going. So it was a lot and very challenging for them and scary. But then I come in and they're comfortable and tell me about their experience and we chat about it and, you know, over while he's eating lunch or dinner or something. So yeah, it was good and getting him out for walks and stuff. And so very, very important to keep these people safe at home.
Really proud to be, you know, part of the frontline worker group, and we make a huge difference in our seniors' health. Like really keep them safe at home.
I'm not a hero. Saying hero means like I'm doing something big. It's something I do every day. It's not a hero by what you do. It's not only a job. It's something that you care about. Caring is you do something for somebody else that can't do for themselves. Like what would we have done if everybody that I had in the shelter on my floor was sick? Who's going to take care of them if nobody else would? It's like people like me or somebody else would have to. So it's not a hero. It's just you're doing something for somebody else.
Thanks so much for watching this week's episode of Operation Support Local. If you have a story idea you'd like to share with us, we recommend you visit our website for all the contact information. Thanks so much for watching, and be sure to tune in next week at 7:30 p.m. for a new episode of Operation Support Local.